Hi, this is Amanda. This is task 3, equipment and supply setup for a surgical procedure. First of all, I will just put here that my certificate is in place during all of my tasks, showing that my facility is allowing me to do these. For our surgical procedure, what you'll want to do is make sure that you have adequate endotracheal tubes, and you'll want to make sure that the cuffs are not going to leak. So what you want to do is you'll want to actually inflate them prior to surgery and just make sure that there aren't any leaks prior to induction, so that you're not running into a problem when your patient is induced. So I'm just going to go ahead and inflate these. And make sure that they're not leaking. So I've got 2 of adequate size for our patient today that is being spayed. She's about 25 and a half pounds. I've got securing ties here to help secure the tube in place after she's been intubated. I've got an inflation, a syringe that we use to inflate the cuffs. So that's a 12 milliliter. I've got my catheter supplies here, which include I've got a couple of 22 gauge that seems appropriate for her size. So what we'll want to do is you want to flush your catheter with heparinized saline. The standard dilution is 5 units of heparin per 1 milliliter. Our syringes, this is a 3 milliliter, so there is 15 units of heparin. So what you want to do is go ahead and take the cap off, and then take your plug off. Go ahead and flush your catheter, and then replace your plug so that it's flush for the IV catheter setting. I've got my cap as well for the IV catheter. For setting the catheter, you will need several different supplies. Clippers to clip all of the hair around the whole leg so that it is good and free of fur and more sterile. I've got my antiseptic, so I've got my chlorhexidine scrubs here, and then I've got my alcohol swabs so that I can do several different cleanings around the IV catheter area prior to placing that. I've got 1-inch tape and 1/2-inch tape to secure the catheter to the leg. When we're inducing, we'll want to lubricate their eyes. We use artificial tears for that, so you'll want to make sure to apply that liberally so that the corneas stay nice and moist during the procedure. You always want to have oxygen mask. You do want to pre-oxygenate all of your surgical patients for about 5 to 7 minutes prior to induction. So you'll want to have that on hand, as well as a stethoscope to check, frequently check the heart rate, but definitely check that initially. You want to have that, make sure that's in good working order. You'll want to just make sure that that you have an emergency kit or some type of emergency supplies available that all of the medical personnel know. Here at our hospital, everyone does know where the emergency kit is placed. It has emergency kit on the front, on the tape, and it's got fluids, extra tubes, breathing apparatus, other syringes, gloves. It has just about everything that we would need. And then we have all of our emergency drugs here. We've got our epinephrine, our atropine, diazepam if there's a seizure, lidocaine. We've got naloxone if we need to do any reversals of certain induction drugs. We always calculate all of our emergency drugs, so we'll have the patient's information and with all of those calculations already made up for us, so that we're not having to do that on the spot. We've got all of our warming devices as well. We've got towels, obviously, to keep the patient warm during procedure. We've got circulating warm water blanket, so that will be on and warm prior to the procedure, so that the patient hopefully stays warm. We also have a warm air breathing unit, so we can use that to hopefully keep them, just another way to keep them warm during the procedure. For today's procedure, since our patient is relatively small, she's 25 and a half pounds, we'll be running her oxygen at about 1 liter during the procedure. Finally, we do have our IV fluid pump as well set up here. We have the fluid rate already preset here on all of the drug doses. We like to know what the maintenance, the surgical maintenance rate is for all of our patients, so we have that set up. And then it looks like we're pretty ready to go. Otherwise,